Hello everyone, I'm Dr. Ekta Bhushan, teaching anatomy and physiology of exercise, sports medicine and exercise prescription at Indira Gandhi Institute of Physical Education and Sports Sciences, University of Delhi. I welcome you all to online lectures of CEC-UGC. In this series, we will discuss different topics associated with sports medicine, but today in particular, we will discuss the topic passive movements and active movements. So we have a tendency to move actively. Active movements demand your attention. It's usually a bit delayed and less accurate. If your movement is passive, your reaction could be quicker, more accurate, and you can flow more smoothly with your surroundings, according to force, according to attention, and relative to another object. So let's see if our movements are according to force. So the first aspect is about a force which is moving with your body. First is passive movement is made by external force, the force of another person, gravitational force, force on transport, etc. And active movement is made by internal force, muscles, tendon, fascias, the potential of gravitational force. Now, according to attention. So, the second aspect is about your attention. The active movement need your attention and the passive movement doesn't need your attention because it is because of some help. Then, now relative to another object, we can recognize active and passive movements relative to another movement objects. Passive don't move with an object, active don't move with an object. तो किसी के साथ नहीं होता. Now, actively try to move with an object, focus awareness. Movement is delayed and broken. In passive movement, with movement flows smoothly with an object. Add active movement to passive movement. This is an efficient way to move smoothly and actively. Now let's see and let's start with passive movement and see what is passive movement in exercise. So during a muscle inactivity, passive movement is produced by external force of when muscles activity is voluntary, reduced as much as possible to allow movement, and passive movement is performed by other than the individual. Now we can see the classification of passive movement. In classification, we can divide it with the relaxed passive movement and passive manual mobilization techniques. In relaxed passive movement, it is accessory movements, and in passive manual mobilization, mobilization of joints, then mobilization of manipulation of joints, control, sustained stretch of tighten and structures. Now let's start with relaxed passive movement. In relaxed passive movement, the first one is relaxed passive movements. So relaxed passive movements, the physiotherapists, therapist perform these movements accurately and smoothly. It is necessary to know the anatomy of joint to perform passive movements. Only the therapist should do it. The movements are performed as active movements in the same range and direction. The joint is moved smoothly and within the limit through the existing free range active movements. The joint is moved through the existing free range of motion and without pain or within the pain limits. Now let's second one is accessory movement. So accessory movement, these movements occur as part of any normal joint movement but may be limited or absent under normal joint conditions. They consist of gliding of rotational movements that cannot be performed as a voluntary movement in isolation but can be isolated by the physiotherapist. Then passive manual mobilization techniques. The first one is joint mobilization. So the joint mobilization, these area unit typically tiny repetitive periodical rhythms, native accessories or purposeful movements performed by the healer at completely different amplitudes inside the offered, vary and below the management of the patient. These can be done very smoothly or quite and are graded in the way they are performed according to the part of the available range. Voluntary movements under what conditions? Then manipulations of joints. In this we have physiotherapist. These are accurately localized, single, quick, decisive movements, Luke and high velocity, complete before the patient can stop it. During this, anesthesia is given by a surgeon or the increase in the movement, and surgeon physicians, the movement are performed under anesthesia physicians to gain a further range of motion to be maintained by the physiotherapist. Next one is controlled sustained stretching. So controlled sustained stretching of tightened structures, passive stretching of muscles and on increased range of movement. So motion of muscles and other soft tissues can be given to the range of movement. Movement can be gained by stretching these structures or by lengthening of muscles due to inhibition of the tendon protective reflex. Now, let's see the principles of giving relaxed passive movements. So, the first principle is relaxation. So, a brief explanation of what is to happen is given to the orient, who is then taught to relax voluntarily, except in cases of flaccid paralysis when this is unnecessary. So, the selection of a suitable starting position ensures comfort and support, and the bearing of the physiotherapist will do much to inspire confidence and cooperation in maintaining relaxation through the movement. Then fixation. So where movement is to be limited to a specific joint, the bone which lies proximal to it is fixed by the physiotherapist as close to the joint line as possible to ensure that the movement is localized to that joint. Otherwise, any decrease in the normal range is readily marked by compensatory movements occurring at other joints in the vicinity. The next one is support. So, full and comfortable support is given to the part to be moved so that the patient has confidence and will remain relaxed. So, the physiotherapist grasp the part firmly but comfortably in their hand, or it may be supported by axial suspension in slings. The latter method is particularly useful for the trunk or heavy limbs, as it frees the physiotherapist's hand to assist fixation and to perform the movement. So, the physiotherapist's stance must be firm and comfortable. When standing, her feet are apart and placed in the line of the movement. Then traction. Many joints allow the articular surfaces to be drawn apart traction, which is always given in the long axis of a joint. The fixation of proximal to the joint providing an opposing force to a sustained one distal bone. Traction is through to facilitate the movement by reducing intra-articular friction, and the range of movement is as full as the condition of the joint out eliciting pain. Then range of motion. So the range of motion is as full as the condition of the joints permits without eliciting pain or spasm in the surrounding muscles. Normal joints slight overpressure can be given to ensure full range, but in our care is needed to avoid taking the movement beyond the bone proximal to the pull on the distal bone. The movement beyond the normal fail joint care is the anatomical limit. So as one reason, extensibility of muscle must be given one reason for giving full range movement. Range movement is to maintain the which pass over the joint, spatial consideration which passes over two or more joints until they are simultaneous is extended with muscles must be progressively extended over each joint until they finally extended to their normal length over all the joint. Example, the quadriceps are fully extended when the hip joint is extended, the knee flexed. Now speed and duration. So as relaxation must be maintained throughout the movement, the speed must be uniform, fairly slow, rhythmical. The number of times the movement is performed depending on the purpose for which it is used. Now let's see effects and uses of relaxed passive movements. So adhesion formation is prevented and the present free range of movement maintained. One passive movement will given and a frequent intervals is sufficient for the purpose, but the usual practice is to put the joint through two movements twice daily. When active movement is impossible because of muscular efficiency, these movements may be helped to preserve the memory of movement pattern by stimulating the receptors of kinesthetic sense. Now, when full range active movement is impossible, the extensibility of muscle is maintained and adaptive shortening prevented. So, the venous and lymphatic return may be assisted slightly by mechanical pressure and by stretching of the thin-walled vessels which pass across the joint movement. Relatively quick rhythmical and continued passive movement are required to produce this effect. They are used in conjunction with elevation of the part to relieve edema when the patient is unable or unwilling to perform sufficient active exercises. So, the rhythm of continued passive movement can have a soothing effect and induce further relaxation and sleep. Training relaxation, and if successful, the movement is made imperceptibly. They may be tried in and progressively slower as the patient relaxes. Now let's see principles of giving accessory movements. So the basic principle of relaxation and fixation apply to excess movements as to relaxed passive movement. Full and comfortable support is given and the range of movement is as full as the condition of the joint permits till the end of range of motion. Now we'll start. Then effects and uses of accessory movements also. So accessory movements contribute to the normal function of this, and in which they take place or to adjacent joints. The function of the joint in abnormal joint conditions and affects movement due to loss of full act contraction of soft tissue, adhesive formation. Accessory movements are lost range of movements and to an important part of the treatment normal active movement in abnormal joint condition. There may be a limitation of these movements of full active range caused by the stiffness of joints from adhesive formation or muscular inefficiency. Now let's talk about active exercise or active movement. Is a term commonly used by physical therapy, rehabilitation and fitness center. Active movement is that which is an individual does voluntary movement, one's own strength or energy. Active exercises helps keep joint flexible, maintain good blood flow to the exercise joint and may help prevent blood clots. A healthcare practitioner may assign active exercises after an injury or in connection with medications and other therapies to help manage chronic pain. Let's see the definition of active movement. So the movements performed or controlled by the voluntary actions of muscles working in opposition to an external force. Now let's see the classifications of active exercises. So first one is free exercises. The working muscles are subject only to the forces of gravity acting upon the part movement or stabilized. The second one is assister exercise. When muscle strength or coordination is inadequate to perform a movement, an external force is applied to compensate for the deficiency. Then assisted resisted exercises. So the muscles may be strong enough to work against resistance in part of the range and not in others. This type of exercises ensures that the external forces applied are adapted in every part of the range to abilities of the muscles. Then resisted exercises. The forces of resistance offered to the action of the working muscles are artificially and systematically increased to develop the power endurance of the muscle. Now let's see the classification of muscle contraction. So the contraction in muscles occur when a person does some activity and the muscle in the body contract, for example shortening and lengthening of the muscle. And in this, the first one is isotonic contraction, and isotonic contraction occurs when a muscle changes length when contracting under a constant tension. While we often think of a muscular contraction resulting in muscle shortening, it can also lengthen depending on the force being resisted. As such, there are two types of isotonic contraction. First is concentric, the shortening of the muscle, and the other one is eccentric, the lengthening of the muscle. Let's see the concentric contraction. So we can see that the concentric muscular contraction occurs when a muscle shortens in length while overcoming a resistance or load. In this case, the muscle exerts more force than the resistance. For example, the examples of concentric muscle contraction: lifting a dumbbell like this during a bicep curl. Here the bicep brachii contracts concentrically, working against gravity to lift the dumbbell. As the bicep muscle shortens, it pulls on the bones of the forearm, decreases the angle at the elbow, and lifting the weight upward and towards the shoulder joint. Then eccentric contraction. Eccentric contraction is contraction occurs when the muscle fibers lengthens under the tension. This type of contraction normally occurs against gravity, such as the lowering phase of a bicep curl or pull-up. Then comes the isometric muscle contraction. The isometric contraction occurs when a muscle contracts without shortening or lengthening. In this case, the force exerted by the muscle is equal to the force, that is resistance. Consequently, the muscle remains the same length. Now let's see the effect and uses of free exercises. So first effect is relaxation. Rhythmical swinging movements and those which are pendular in character assist the relaxation of hypertonic muscles in the region of the joint movement. The second one is joint mobility. The normal range of joint movement is maintained by exercises performed in full range. If and when the range of movement is limited, rhythmical swing exercises incorporating overpressure at the limit of the free range may serve to increase it. Then muscle power and tone. The power and endurance of the working muscle are maintained or increased in the response to the tension created in them. Then neuromuscular coordination. Coordination is improved by the repetition of an exercise as the pattern of movement is established. Now we have come to conclusion. So the range of motion is the capability of a joint to go through its complete spectrum of movement. Range of motion of a joint can be passive or active. Passive range of motion can be defined as the range of motion that is achieved when an outside force such as therapist cause movements of a joint and is usually the maximum range of motion that a joint can move. Active range of motion is the range of motion that can be achieved when opposing muscles contract and relax, resulting in joint movement. For example, the active range of motion to allow the elbow to bend require the bicep to contract while the triceps muscle relaxes. Active range of motion is usually less than passive range of motion. Range of motion therapy is beneficial in healing and in recovering from soft tissue and joint lessons, maintaining existing joints and soft tissue mobility, minimizing the effect of contracture formation, assisting neuromuscular re-education and enhancing synovial movements. So I hope you understood about the concept of active and passive exercises, their types or classification and their effect and uses in detail. That's all for today. See you next time. Thank you.